In this video, we'll walk you through how to properly shock bottle-fed dental water lines. If your clinic uses a direct feed setup, please contact Agenix support so we can help you find the best solution for your specific configuration. Shocking your water lines is an essential part of maintaining a safe dental operatory. The term shock refers to a more aggressive treatment product designed to reduce microbial contamination. In some cases, these products can also remove biofilm. Routine waterline treatments are designed to maintain low bacteria levels and prevent regrowth, so shocking is often necessary before beginning a regular maintenance protocol. Shock treatments are also required when a waterline failure has occurred, as maintenance treatment alone cannot control a failing waterline. In short, shock products reduce bacteria and remove biofilm, while treatment products help maintain those lower levels. Think of shock products like a drain cleaner, powerful and effective when used periodically, but potentially harmful to equipment if used too frequently or for longer than recommended. There are several types of shock products available, including liquid solutions and tablets. Some liquid options are two-part formulas that must be mixed before use. If you are addressing high CFU count failure, combating biofilm, or getting started with treatment for the first time and want to reset your water lines, a shock product with specific claims to remove biofilm is recommended. It's important to carefully review the instructions for use, or IFU, as each product has different claims and requirements. Dilute bleach is another effective and affordable option, though it was not originally designed for dental water lines. Because bleach instructions for use do not reference dental applications, it's critical to follow specific instructions if you choose to use it as a shock method. We have this resource available for download on our website. Before you begin the shock procedure, put on gloves and ensure your workspace is clean. Some shock products require additional PPE, such as safety glasses. Remove any handpiece tips or similar components, and some products may even require couplers and other such components to be removed as well, which will be specified in the IFU. Not all maintenance treatment and shock products are chemically compatible. Agenix has a table on our website which explains the compatible and incompatible products. If you are using a straw treatment product, running an incompatible shock solution through the straw can damage or even destroy the straw. It is recommended to remove the straw and replace it with a temporary pickup tube. Your straw manufacturer or Agenix can provide this tube if needed. It is best practice to run half a bottle of untreated water through the lines to flush out the maintenance treatment before introducing the shock, and then another half bottle of untreated water once the shock process is completed. Best practice is to maintain a dedicated shock bottle in your office. If using the same bottles, just be sure to rinse them before and after the shock with untreated water. Prepare the shock solution in the operatory bottle according to the instructions, paying close attention to the required volume of water. This ensures the active ingredient reaches the necessary concentration. Once the solution is ready, reattach the bottle to the unit. To apply the shock, run the solution through each water line until the color appears in the outlet water. Even lines that are rarely used should be shocked. Allow the solution to sit in the lines for the time specified in the instructions. Do not exceed this dwell time, as some formulas lose effectiveness over time, and the biofilm removal is not guaranteed if not flushed properly. Many shock products include tags or cards that can be used to alert staff that a shock procedure is in progress, and not to use the operatory. Once the dwell time is complete, empty the bottle and refill it with clean water. Flush the lines thoroughly to remove all traces of the shock solution. Be aware that some shock and treatment products are not compatible and may produce undesirable byproducts if mixed. It's a good idea to flush with untreated water, but make sure the water used contains fewer than 500 CFU. Once the shock is fully flushed from the lines, add your treatment product and flush again to ensure treated water is present throughout the lines. If you have shocked in response to a water test failure, the chair can be returned to use once the shock process is completed or kept out of commission until a passing water test is obtained. This is an important decision for your team to agree on and build into your standard protocol. A retest is required to confirm that the shock brought the bacteria levels below 500 CFU. It is best practice to retest 3 to 5 days after shocking so that you obtain a clear picture of the bacteria levels. If a retest is conducted too soon, you may see a false pass due to the recent shock. Finally, document the procedure. Record the product used and the water test results from before and after the shock if applicable. This helps maintain compliance and ensures your operatory remains safe for patient care. To recap, shock treatments reduce bacteria and biofilm and are essential to initiate a treatment product and remediate waterline failures. Remember, there are differences with each product, so you should always review and follow product instructions for use. Thank you for watching and for trusting Agenix Labs as your waterline management partner. With Agenix testing, you're taking a proactive step towards safer waterlines and better patient care. Be sure to check out our other videos for more tips on waterline maintenance and testing.